Okay, welcome. Let's go with the craniovertebral joints, which happen between the occipital bone and the atlas and the axis. They are very, very important to chiropractors, as you will understand, and they are quite complex because of the ligaments that we are going to see right now. Okay, so first we have the joints between the superior facets of the lateral masses of the atlas and the occipital condyles. As you see in the image, the lateral edges of these joints are higher laterally than medially. Okay, so they only permit movements in a sagittal plane. That is flexion and extension of the neck when you say yes with your head. The atlas and the axis articulate by means of three synovial joints. One of them is in the midline and it's called the atlanto-odontoid joint, which is a pivot type joint. As you see in the top image, this joint has an anterior synovial cavity between the axis dens and the posterior aspect of the anterior arch of the atlas. But it also has a posterior synovial cavity between the posterior surface of the dens and the anterior aspect of the transverse ligament of the atlas. We'll see this ligament in a minute. Finally, underneath we have, at a lower level, we have two lateral atlantoaxial joints. These are the type zygapophyseal joints. And as you see in the red circle, the angle of these joints with the vertical is about 110 degrees. So the direction, the surface of the articular surfaces have an angle which is opposite to the one between the atlas and the occipital bone, which is above. Okay, right there. Okay. Given the narrowness of this area and the weight of the head, integrity of the ligaments of the upper cervical spine is essential. Have in mind that osteoarthritis, for instance, and osteoarthrosis is a common disease or problem in this area and may cause insufficiency of these ligaments. Also, for instance, in children with upper respiratory tract infection, this ligament may be attenuated by inflammation. So, assessment of these conditions and accurate knowledge of the anatomy is extremely important to chiropractors. Let's go with the ligaments. First, the picture. How to look at this picture? Well, this is a posterior image of the area where the back of the vertebra have been cut and it's showing the inside of the vertebral canal. So you see there are many ligaments in the inside of the vertebral canal. First, we have the anterior occipital membrane. Okay, this one we cannot see it in this image in particular because it's in the anterior side. So here is represented is number 1 in the drawing with a dotted line. Okay, this ligament is connecting the foramen magnum, the big hole to the head in the occipital bone, It's connecting that foramen to the arch of the atlas. And we'll continue with the anterior longitudinal ligament down the whole spine, and well, you'll understand because you will see this ligament later. Then we have the apical ligament that attaches the tip of the dens to the foramen magnum, and following we have two alar ligaments that attach the tip of the dens to the occipital condyles and to the lateral masses of the atlas. So this can limit rotation and lateral flexion of the head and the atlas. As you already know, the transverse ligament of the atlas is holding the dens against the atlas. Some of its fibers travel upwards to attach to the occiput, and these are called transverse occipital ligament. And there are other fibers that extend downwards to the axis, and these are known as transverse axial ligament, because it draws a cross. So you have the transverse plus fibers going up and fibers going down. It draws a cross, and sometimes it's known as the cruciform ligament. If this ligament is damaged in any way, the dens may move backwards and affect the spinal cord. So it may impinge the spinal cord, which is not good at all. Okay, you understand that. The accessory atlantoaxial ligaments attach the base of the dens to the lateral masses of the atlas. So they collaborate in maintaining the dens at its right place. And then we have the membrane tectoria, which is a prolongation of the posterior longitudinal ligament. We'll see it later. And in this area, it reaches the occiput, which is situated above. All right, then the posterior atlanto-occipital membrane represents the ligamentum flavum at this specific level. Okay, we can see it here because the posterior half of the vertebrae is removed, and this is a ligament is joining two laminas in the whole spine. So here is cut. This ligament forms the channel for the vertebral artery and the first spinal nerve on the posterior arch of the atlas. So it's very particular. If it gets inflamed for any reason, it may put pressure on the nerve or on the artery. Then we have the lateral atlanto-occipital ligaments that reinforce the capsules of the atlanto-occipital joints. These are like the first zygapophyseal joint. And finally, we have the fibrous capsules of every craniovertebral joint, because they are considered part of the holding structures of the joints. All right, so these two drawings, they come from a book. It's called Testud. It's from the French School of Anatomy, and these are the ones I used when I was in the medical school. Very, very well done. Below this complex craniovertebral region, we have the rest of the cervical spine. Between the vertebral bodies of this second section, there will be intervertebral discs to allow for a greater range of motion of the spine. Only the discs account for 25% of the length of the cervical spine. Okay, so let's go with the ligaments of the rest of the cervical spine, and some of them they are all along the rest of the spine, and they are not so complex. All right, so the first we have is the anterior longitudinal ligament, and this one travels all along the anterior surface of the vertebral bodies from the occipital bone to the sacrum. It is quite strong and has 3 layers that resist extension of the back. So when you extend your back, this becomes tighter. Okay, the posterior longitudinal ligament is posterior to the vertebral bodies, so it is located inside the vertebral canal. It has only 2 layers and is going to resist flexion of the spine, that is bending forward. As any synovial joint, the zygapophyseal joints have a fibrous capsule, but in this case is quite loose to allow for great mobility of the cervical spine. All right, more ligaments. Here we have in figure 1 what we call ligamenta flabba. These connect to adjacent lamina in the posterior aspect of the vertebra. These are elastic and allow for flexion but prevent hyperflexion of the back. Okay, so they are loose until you bend too much. All right. Figure 2 displays the ligamentum nuchae from the occipital protuberance of the occipital bone to the spinous processes of all cervical vertebra. It is very easy to palpate and is going to offer insertion to the trapezius and splenius muscles that we will review in the next videos. Then further down this ligament is a thinner one that is known as the supraspinous ligament. Okay, you can see it in also in figure 3, like a thin string jumping from one spinous process to the other. Okay, but between the spinous processes in figure 3, we can see the interspinous ligaments. All right. Okay. Also, one last thing is between the transverse processes is not shown here. It should be seen in figure 1. Between the transverse processes, we have also ligaments jumping from one transverse process to the other. All right, so as said before, below C2 we have intervertebral discs. These are they belong structurally to the symphysis group, and they act together to allow quite a range of motion in the cervical spine. As for the rest of the spine, we also have zygapophyseal joints at this level, which are synovial and allow flexion, extension, rotation, and lateral flexion. So they can move a lot and need to have loose capsules. And finally, we have special joints at this level called the joints of Luschka, or also uncovertebral joints. And these happen between the lateral superior border of C3 to C6. These are synovial joints, although not everyone agrees that they are real joints. They permit flexion and extension and limit lateral flexion movement. Have always in mind that all these complex joints have to work together at the same time, so isolated movements of a single joint are not possible. All right, due to the presence of the ribs, I think we explained that in one of the seminars. The ribs articulate with the vertebra, with the vertebral body and transverse processes, but in front, in the anterior wall of the thorax, they articulate with the sternum. So the thoracic spine is quite rigid in comparison with the free cervical spine. This means that at the cervical thoracic junction, problems may arise due to this difference. One moves a lot, the other is quite rigid. So you will find normally degenerative changes at the level between C6 and C7 or C7 and T1. Okay, so be aware of this. Thank you. I think that was enough for this video. See you soon.